I think so, and it's particularly relevant in the context of Omicron, which compromises the ability of two doses to do its job well. If we were still dealing with Delta, I'd be pretty confident that two doses can get us back to some semblance of normal pretty fast, but Omicron has changed everything. And three doses with Omicron really ratchets up the ability of the vaccines to keep us out of the hospital and out of the morgue. But more importantly, it also increases the ability to prevent infection and transmission, something that two doses doesn't do anymore. I'm sure it's something deep in the biology. I'm not a microbiologist, I'm an epidemiologist, so I can't say for sure. But it probably has something to do with the matching of the vaccine antibody response to the actual physical construct of the virus. That's the fear, right? That's the fear. This has always been a crisis of the healthcare system. In the longer term, though, it might be a crisis of some degree of long-term disability as more people get long COVID. We don't want that. But in addition to the healthcare system overuse, there's also the danger of too many people being taken out of the workforce because they're homesick. And we can't have entire industries being stifled because of insufficient numbers of workers. So at the population level, when we start seeing the hospital use increase, particularly in certain demographics, I'm talking here about children who can't get vaccinated, I think the crisis will be on us again. That's exactly it. It beats us down until we are psychologically threadbare. That's the problem here. This sort of long-term pandemic response requires psychological resilience on the part of the population, and we're showing we don't really have it. And some of our political leaders are taking advantage of that insouciance a little bit, I think, by declaring the pandemic to be over when it's not over. Now, I'm not saying we have to go back to full-on restrictions and things like that. We can have an open society. We can have businesses fully open. We just need to enact some important public health measures like mask wearing and getting that third dose into more people. Yeah, in Ottawa, it's May 1st is when the mask mandate ends. I do think it's a premature move. And the reason for that is a number of things. Number one is we enacted the mask mandates when we had about 150 cases per day in Ontario. We have well over that. We have hundreds, if not thousands, of cases right now per day, and we're taking the mask off the table. The second reason is mask wearing is a high impact, low cost, easily manageable intervention with almost no downside associated with it. So it strikes me as the last thing we should be taking off the table as this thing wears on. I don't know why it's being taken off the table. It's an obvious thing to keep on doing, and I think people need to have more education about the kinds of masks and how well to use them. So yeah, masking should still be done, and I understand the mandate is gone now. So I implore people to consider choosing to wear a mask, and if you choose to wear a mask, wear a high quality one like an N95 or a KN95. That, yes. That's exactly it. Protect other people. You may feel invincible. Maybe you've got 3 doses. Maybe you've got a great immune system and are strong, but there are kids under 5 who can't get vaccinated. There are elderly who are at high risk. They're immunocompromised. Let's be community minded and slow transmission as much as we can. Thank you. Bye-bye.